Hello, everybody, and good evening. I'm Dr. Charlotte Norton, joining you again for another live this evening to talk once again about all things weight loss and all things weight loss medication. Thank you for those who are joining me, and thank you for anybody who might be watching this thereafter. So just going to give a few moments for a few others to join us before I launch into it. But just to say, today we're going to talk about a couple of things. We're going to touch on a few areas. The first is we're going to talk a little bit about Wegovy, one of the weight loss medications, and some of its association with treatment of heart health. We're going to talk a little bit about endometriosis, because endometriosis week is coming up as well, and how weight loss can maybe help with the symptoms of endometriosis. We'll talk a bit about World Obesity Day, which is coming up, and why it's such a good thing to get behind. And also maybe a little bit about Ramadan as well, which is also near on our doorstep. So if any of those topics you're interested in, then please do fire a question across. And like I always say with these, it's great that they're interactive. We've had some great questions the last few times we've done this. So I'm more than happy to answer your questions. If it's not about one of those topics, it could be about anything. So please do shout out if there's anything you want to discuss. So right, super. Without further ado, then let's get going. So the first thing that we're going to touch on is about Wegovy, which is one of the weight loss medications that we prescribe here at the Slimming Clinic, and people have heard lots about. And it contains the active medication semaglutide. We've talked about this on a couple of the other Facebook lives. Semaglutide is actually the drug, and Wegovy is the name for the pen that's licensed for weight loss. We all have heard about Ozempic as well, which was the pen that containing semaglutide that came out first, that was licensed for diabetes. So obviously, when these drugs come to market, they have lots of medical trials to assess how safe they are and how they work. But once they come to market, they also continue to have trials that look at lots of different elements about the drug. And one of the things that have come out of subsequent trials, when they've been looking at the positive effects of semaglutide or Wegovy on the body, is that they've noticed that or they've seen in the studies that people who have a cardiovascular risk, so a risk to their heart health, and by taking this medication, they get a 20% risk reduction in having a major cardiac event, so something like a heart attack or a stroke. So two quite big, quite scary medical issues to happen. Nobody, having a heart attack or having a stroke are quite big, significant health events. So what this means is that for patients who have a BMI of 27 or upwards, who've got a history of cardiovascular disease of some form, by taking Wegovy, not only are they going to hopefully lose weight through the way it works to help us lose weight, which in itself helps to improve heart health, but also alongside it, you're getting that additional extra 20% risk reduction in your chance of having one of those types of events. As I say, the ones that they're looking at is things like having a heart attack or having a stroke. So again, those real big, quite scary things. Now, why is this applicable? Why is this something interesting? Well, we know that being overweight and being obese can have effects on the body. And we know that sometimes those effects can be things like raising the level of inflammation in the body. And we know over time, they can have quite a significant effect on our heart health. It might be something as you've noticed that maybe your blood pressure's gone up, or you notice that maybe when you've had your bloods checked, your cholesterol, your triglycerides are going up. All these couple of things that might make you concerned about your own heart health. Or you might know that you've got a history of heart disease, maybe that you've had an issue before, maybe you've had a little scare, something like a mini stroke or something like that. So considering taking Wegovy now is an even better reason than just simply taking action for your weight, because you're going to get those benefits, but also we know now you're going to get those additional heart health benefits. So I think this is a really important thing for us to think about when, not only as doctors, we're consulting patients, when we're talking about which weight loss injection might be better for you, but also not only if it's yourself, but if you know a loved one maybe who's had a near miss with one of a scary heart health event, and maybe their weight is increased, then maybe it's worth sort of talking to them about it and saying, look into this. Maybe this is a time to think about starting treatment to kind of get that double benefit, that hopefully that reduction in heart health risk, as well as the extra reduction that you'll get from losing weight and improving your health, and hopefully changing your diet alongside it. So it's something that our doctors talk to our patients about when they come for consultation, but again, you know, is something to consider. And again, just to say with that, you do still have to have a raised BMI to qualify for it. So you need to have a BMI of 27 and above. But again, if you are somebody who has a heart health risk, or you know, in your family, there's maybe quite a big family history of heart health risks, especially of cardiac events before the age of 60 in your first degree relatives, so parents or siblings, etc., then definitely worth when you're weighing up which medication is better for you. So absolutely, please, you know, please do ask your doctor when you come to your next appointment, if you're here with us, or, you know, when you're deciding maybe if you're going to the online route of requesting medication, when you're weighing up which medication might be better for you. If there is a history of heart health, then maybe it might be better to consider Wegovy for your treatment. Okay, right. I can't see I've got any questions about that at the moment. So I shall move on and talk about our next topic. But please, if there is something you want to ask, then please do shout. The next topic we're going to talk about is something called endometriosis, because Endometriosis Awareness Week is upcoming. And I'm sure in the comments we'll put a link to a blog post we have on our website, which is really informative about endometriosis. So, you know, please do have a look at that if it's something you suffer with or think you might suffer with. So what is endometriosis? So it's a condition that affects women because what it is deposits of what is the normal womb lining occurring outside of the womb. So commonly it's on things like your ovaries or the tubes between your womb and your ovaries, but it can be on bits of the bowel and gut and other organs that are nearby. And again, this can lead to having pelvic pain in the pelvis. It can lead to heavier bleeding. It can lead to irregular bleeding, and it can be a cause of contributing towards infertility. So it's quite significant. It's going to be disrupting your daily life and or maybe your plans for building a family. So how does losing weight have an effect on endometriosis? Well, there's a couple of things to consider when we're talking about this. So what we know is that when those areas of the uterine deposit outside of the womb obviously get affected by the fluxes in our hormones each month, just like their lining in the womb does. So it sort of grows in the beginning part of your cycle and then sheds during the time that you're bleeding. So we know that the hormones in our bodies are having an effect on that tissue and can aggravate the tissue and cause pain and discomfort. When we have areas of fat in our body, fat doesn't just sit there doing nothing. It's actually quite metabolically active. And one of the things it does is it makes some of the sex hormones like estrogen. And estrogen has an effect on the tissue. So by having more fat mass in the body, this can cause a disruption to your normal hormonal balance, which could potentially extenuate the effects that you're getting of pain and discomfort during certain times of your cycle. So one of the benefits we know is by losing weight, it helps to improve the hormonal cycling, which again can have an effect on reducing some of the pain and discomfort of endometriosis. We also know that, again, that fat tissue, not only does it create hormones, but it also can release inflammatory chemicals in the body. So that's how part of the process of how we start to develop some of the risks to health when we're overweight or obese for a long time, because that level of inflammation starts to have an effect on the organs of our body. So that's again, when we're coming back to heart health, it has an effect on the heart, but it can have an effect on this type of tissue as well, again extenuating the pain and discomfort you get with having this condition. So we know that by, again, losing weight, it helps to dampen down some of those levels of inflammation, which may in itself help to, again, improve the symptoms of suffering with endometriosis. And, you know, alongside what we know in terms of helping to improve the symptoms and what you're experiencing, is that we know that endometriosis can have an effect on fertility, which we've mentioned, which obviously, if you're planning a family, could be something that's causing you a bit of a disruption and it can be causing you significant distress. So again, by losing weight, it might help reduce your symptoms that you're experiencing, but we also know that reducing your weight and reducing your BMI can also help improve fertility. And we know that if you are seeking fertility treatment, sometimes losing weight is part of what you need to do to make that treatment a success. So there are several reasons why, if you're suffering with endometriosis, it might be a good idea to consider looking into reducing your weight. And absolutely looking at ways that you can do that. Now, obviously, when we come onto these lives, we've talked a lot about medication and medication options for helping to support you losing weight. So there are ways that these medications can absolutely help you achieve that goal. Obviously, we've talked about this in previous lives, but weight loss medications, and the ones that we hear a lot in the media, Wegovy, Mounjaro, what they do is they help you to control your appetite. They reduce your appetite. They improve how full you feel when you're eating, so you feel satisfied and full sooner. So therefore, they help you to manage the dietary part of losing weight, so helping you reduce that daily calorie intake and stay and stick to that weight loss plan. We all know what it's like when you start a diet. The first thing that happens when we start a diet is that all of a sudden all we think about is what we're going to eat next. Then almost you make yourself feel more hungry. So by taking these medications, it's just that little bit of an extra help, that little bit of an extra support to stick to the dietary plan. So again, it's a great time if you are suffering with endometriosis to have a think about taking action to lose weight for all of those benefits. And again, please do have a look at that blog on our website, because again, there's some great information there. Right, just having a quick look at. Okay, lovely. So no questions from anybody yet. So if you are watching, I can see we've got people watching. If there's anything you want to ask, please do go ahead. Happy to answer anything, whether it's directly about what I'm talking about or anything at all about treatment that you're having for your weight loss. The next thing I wanted to mention is World Obesity Day, which is on the 4th of March. Now, why is this a great day? Because what it does, and the point of it, is to help raise awareness, not only in the general public, but also with healthcare practitioners, about obesity, about its management, about why it occurs, and trying to break down all those taboos and all of those sort of preconceptions about why people might be overweight. We know now that becoming overweight and obese is multifaceted. There's loads of reasons why we may gain weight. Everybody has an individual story to tell. Everybody has a different experience, and everybody's body is different. So there's no one size fits all for losing weight. We know that because there's a variety of tools out there to help you lose weight. There's different diet plans. Something works for somebody better than other things do, and that comes down to lots of variations in who we are and how our bodies work. So what this day does is helps us, and if we are someone who struggles with our weight and has been overweight and or been obese, we know how difficult sometimes it is to broach the topic with a healthcare practitioner. You may be considering getting weight loss medication, and you may think about how would I broach that with my GP? Would they judge me? Would they think I was cheating by looking to use tools with things like medication? So this day is about raising the awareness with healthcare practitioners about obesity, about why it can happen, and about the options out there. So it helps us access services. So at the Slimming Clinic, we here this is our area of expertise. This is where we work every day. We talk to patients every day, and you come to us talking to us about your weight. So here, we have a very open policy about talking to you, and we understand the differences in everybody. And that's why we've got a team of doctors, of dietitians who have put together a variety of resources to try and help and suit everybody and help them achieve the weight loss results that they would like to. So it's a really great day to get behind the campaign. And of course, there's raising awareness within the general public as well. We know it. I mean, the current statistics with regards to obesity are quite staggering. I mean, I've got them, here with me. We know that worldwide, about 1.9 billion people could be living with obesity by 2035. So that's a big chunk of the population. So this is something that affects lots of people. And again, this movement is to try and raise the profile of obesity and almost consider it as a disease in its own right. Again, that helps to give people more options for accessing treatment and help and support for the treatment of weight loss. We know, the drugs coming to market recently, the injectables, the Wegovy, Mounjaro, they've done a great job in helping people understand that there is a lot of options out there to help you with your weight loss. There isn't sort of the two ends of the spectrum, just changing your diet and having bariatric surgery. There is the gap in between where you can use tools like weight loss medication to help support your weight loss endeavors. That mean you've got a bit more support than simply diet if that hasn't worked for you alone before, and you don't have to go to the other end of the spectrum and have an operation and go down the lines of having some physical change to your body. So this is a great time to raise the profile of treating overweight and obesity, because the results that patients are getting using this medication are fantastic. And in some of the studies, they've shown these results are almost the same as patients could achieve with bariatric surgery. So really fantastic. So again, we want to encourage as many people as possible that might be thinking about it to reach out and find out more information. So it's a great day. You might hear some stuff about it in the press. It's a great day to stand proud for the treatment of overweight and obesity. And the other thing that I wanted to touch on whilst we were here, and if there's anybody watching who is observing Ramadan, is to talk a little bit about that and weight loss medication, because we get asked this quite a lot by our patients. I mean, the Slimming Clinic, we've been treating patients for over 40 years with various forms of weight loss medication. So we've treated a lot of patients who've observed fasting for lots of reasons. And obviously Ramadan is quite a big and important time when fasting and planning how to take your medication can be really important. Again, we've got a great Ramadan guide on our website. And again, I'm sure we'll share a link in the comments. So please do feel free to go there and download the guide if you are looking to observe Ramadan and want some tips on how best to eat and what to eat at the times you are eating and or fasting. I think there's just a couple of bits I wanted to sort of touch on there. I think hydration is one of the really important things to ensure that you have adequate hydration, whether you're on weight loss medication or not, throughout the time that you're fasting, and also then when you're eating, thinking about using foods that have a good level of water within them, things like soups or curries, where again you can just help your body to maintain that hydration, because we know by staying hydrated we can cope a little bit better when we're not eating. Your bodies can cope without eating a lot longer than they can without hydration. So again, keeping that up can help you feel better. And especially if you are taking our weight loss tablets, it's really important to stay hydrated, because there is a risk of getting a headache again if you're not taking enough hydration on board. So that's really important. The other thing that's really important is to make sure when you are eating that you try and cram as much nutrients into those meals as possible, because obviously you've got a shortened window to get all of the nutrients that your body requires to function. So again, planning ahead, thinking about what it is that you're going to make, making sure that you've got some of those important food groups in it, some of those important whole grain carbohydrates and fibrous carbohydrates, which your body takes longer to digest, keeping you fuller for longer naturally and giving you that released energy over time. Having your sort of leaner proteins in there than your heavily fat proteins that make you feel full a bit quicker, but maybe not last you as long. And again, avoiding things like highly processed or highly sugary foods, which your body will quickly metabolize, turn into sugar, and then go. So again, it's about giving your body that level of sustained supply of food and nutrients that will last you through the fasting periods. If you're using weight loss medication, then obviously you might choose to continue that throughout Ramadan. You might choose to stop it, depending on your personal decision. Obviously, there are health conditions that could preclude you from what you need to do during fasting time. So if that is a case, if you have health conditions, things like diabetes, then it is worth talking to a healthcare practitioner beforehand to make sure that that you've got the right balance for you. But as a general rule, we say if you're taking weight loss medication, especially weight loss injections, what's important is to try and keep taking them at the same time every day. Now, we know that they have an effect in the body that lasts. The injections at the moment, they last a full week. So again, try and keep that same time of taking the injection. And the injection should help with you observing the fasting. So, and again, it should help with reducing the amount you eat in the window you're eating. Because again, if our overall aim alongside Ramadan is to lose weight or to continue with our weight loss progress, then again, we don't want to be eating an awful lot during the eating window that then derails that progress. That being said, because of the way you're eating will be so different during that time, it's not a bad time to just be just to maintain your weight. Don't, if you're doing really well with your weight loss, don't feel like you have to maintain weight loss when the way you're eating is going to be totally changed and different. Again, if you simply maintain your weight loss, you retain your weight during that time, again, that's fantastic, because again, the way you're eating may be completely different from how you eat outside of that time. So weight loss injections absolutely can help reduce your hunger when you're fasting, and then again help reduce how much you're eating. But we know that weight loss injections obviously make you feel fuller quicker, so you can't eat as much in terms of your portion. So again, thinking about having a few more smaller meals during that time where you've got lots of nutrients can again help to try and get everything you need in your body in that time. Then the next important thing is weight loss tablets. So our weight loss tablets, again, they can absolutely help support you during the fasting time. And they can also help to reduce how much you're eating in the eating window. However, the tablets have an effect on sleep. So it's important that you think about taking those to ensure that you can get adequate sleep when you plan to go to sleep. So weight loss medication, that we have a few varieties of tablets, but generally they've generally got sort of 12 hours if you're taking a 1-a-day tablet in which that they work. And so you want to make sure you're sort of taking it 12 hours away from the intended time you plan to go to sleep. So the weight loss tablets can be a little bit harder to fit around things. So again, speak to our team of doctors about how best to take them, but you can still use your weight loss medication as a useful tool during that time. Just having a look there, I can see that we popped the links up there. So hopefully there's some great information in there about foods and what to eat. Again, as I said, focusing on how you can fit hydration in. Again, that last meal you have just before dawn, just before sunrise. Again, looking at making sure that that's got good levels of those slow release whole grain carbohydrates, which again can help you have energy. Your body have the energy a little bit longer moving forward throughout the day, or when you are fasting. I can see we've got a question here, so I shall go ahead and answer. Do you have to increase your dose every month? Could I do 2 doses on the same dosage if I feel it's working? It's a great question, and thank you for this. This is somebody, I'm assuming you're on weight loss injections, and the dosing regime with them, for anybody who doesn't know, is you take each pen gives you 4 doses and that dose is obviously the same strength. And you take those 4 doses, and then at the end of that pen, or the end of that month, you then decide if you are going to increase your dose or stay on the same dose. You can absolutely stay on the same dose. There is no reason that there is a rush to increase in dose. The reason that we take the medication, the reason that you take weight loss injections is to help support your dietary efforts. So it's to help you feel in control of what you're eating and overall achieve your weight loss goal. So if the dose you are taking is helping you feel in control of what you're eating, your weight is moving in the right direction, you're losing weight, you're not experiencing any side effects that are niggling or making you feel unwell, then there is absolutely no reason that you have to go up in dose. You can stay on the same dose, do another pen for another month, i.e. another 4 doses, 1 each week, and then have a look at it at that stage. We treat a variety of patients at the Slimming Clinic. Some people stay on the same dose for quite a while because it really suits them and they stay there and they get to that weight loss goal. And there are some patients that titrate up really quickly because their bodies move faster in terms of what they need in terms of dose. Neither way is right or wrong. Although obviously we see in the literature that you should increase each month, again, it's patient specific, and you can absolutely slow down in terms of the race to the top. However, the flip isn't true. So again, you can't go up any sooner. So you need to do each dose for at least 4 weeks before you increase. Okay, so you can't rush that part. That's the more important side, because the way that, again, we know these medications work, the effect they have on the gut, which is slowing down how everything's moving in the gut, which again is part of how you get the appetite reducing effect, means that if you go too soon, your gut might not tolerate the medication so well, and then you could end up with side effects that are uncomfortable or might even make you stop the medication. So don't rush in that way. Definitely do 4 doses and 4 weeks of each dose before you move up, but no rush to move up in dose. And everybody is absolutely different and unique in what they need. But as we touched on in previous lives, and here the medication is just a tool. You do the work. you're the one that decides what you eat, and how you eat and when you eat. The medication is helping you stay in control of that and make those decisions. So the results are all yours. So as long as the medication is supporting what you're choosing to do, then absolutely, you're safe. And I think one of the things this makes me think of as well that we get asked is if, should I move up in dose? Now, again, if you're feeling in control of your appetite and you want to stay on the same dose, then please do so. If you feel actually, no, I'm not in control and I'd like to go up to the next dose, but you're experiencing a side effect, maybe you're feeling extremely nauseous, maybe it's made you sick, potentially it's upset your bowels, you might be feeling very constipated or have very loose stools. If there's a side effect that's really not settling and is causing you disruption, then sometimes it's actually better to stay on the same dose for a little bit longer before you move up, even if you think you could have a bit more control in your appetite, because again, it gives your gut that little bit longer to get used to the medication before you move up, which overall is going to help your weight loss efforts, because you're going to get there eventually, as opposed to having a side effect that you make worse by rushing going up in dose and then thinking you can't tolerate the medication. All the clinical trials talk about the weight loss achieved by patients who've reached the top dose for that set period of time. But what we know from treating patients at the Slimming Clinic, we know from the population taking this medication, is that weight loss starts right from the get-go, right from that first pen. You read that, people start to feel they get more optimal results or optimal effect from the drug sort of 8, 9, 10 weeks down the line. And that can absolutely be true. Again, it's so person dependent, but as soon as you get started with the medication, you will start to lose weight and you'll begin a very positive, hopefully, weight loss journey. And we are fortunate now to have two drugs. We've got Wegovy and semaglutide, and we've got Mounjaro or tirzepatide. So they are two types of weight loss injections that differ slightly in terms of the gut hormones that they mimic. So again, if one's not working for you, you can always switch to the other one. And try that, because you may find that one suits you and your body better. So you've got a few different options there. I think on that, one of the last things that I will also mention is, and we've had this question asked before, is people worry that once they've started treatment and their weight's coming down and their BMI is coming down, that they won't be able to get any more medication if their BMI falls below 30. So those BMI cutoffs that we use to decide upon medication are the starting BMI. So your BMI needs to be either above 30 or between 27 and 30. And there is a reason why in that bracket that your weight might be detrimental to your health. Now, that might be your waist circumference is raised, which tells us you're carrying more weight around the middle, which we know is dangerous to health. It might be that you've started to develop high blood pressure, or your cholesterol is raised, or you might have been told that your blood sugar control is starting to be deranged towards diabetes. So there's lots of reasons why between a BMI of 27 and 30, there can be a medical reason why you're suitable. And there are some races and ethnicities as well where we know that increasing weight is more detrimental to health. So you need to have those BMIs and reasons to get started. But as you move through, we're obviously wanting to get your BMI down. We want to get you back in the healthy range. So absolutely, once you're on your weight loss journey, you don't get denied further medication when your BMI falls below there. So it's really important that you're being honest with your doctor and your team and letting us know how your weight loss is progressing, because again, that has an influence on what we prescribe. But please don't worry that you have to hit those BMIs to have continued treatment. At the Slimming Clinic, we work to get your BMI back in that healthy range. So for us, we're aiming for a BMI that's somewhere between sort of 23 to 25, which is nice and in that healthy weight range, not in the underweight area, but in the healthy weight range. So I think a good message to reinforce there. So thank you to everyone who's joined this evening. I can see we've got some people watching. Is there anybody else? Please do shout if there's any other questions there that you have, or put them in the comments if you're watching this another time, and we will absolutely get back to you. So just to reiterate, there's some great things going on at the moment. There's World Obesity Day coming up on the 4th of March. We've got Endometriosis Awareness Week coming up, so please do have a look at our blog post to see about the benefits of losing weight if you do suffer with endometriosis. There's thinking about weight loss medication and heart health, and thinking about whether you or a loved one might be suitable for treatment, to look at helping improve the risk to heart health. And there's Ramadan coming up as well, so an important time to think about how you're going to use your weight loss medication and how you're going to eat to stay healthy, but also to help maintain your weight loss trajectory as well. So thank you, everybody, for joining me this evening. It's been it's been great to talk to those, and thank you for those who've asked a question. And hopefully I'll be seeing you all again soon on the next live.